All right, I think we're going to get started while folks are signing in. Hello, everyone, and welcome to the Marvin Fireside Chat today on this lovely Friday afternoon, at least here in Pennsylvania. We are here today with Dr. Jennie Byrne. My name is Dr. Is Jacinta Harman, and I'm the Director of Clinical Services here at Marvin. Sorry, Dr. Byrne. Um, Today we're going to be focused on one of the most persistent challenges in healthcare, and that would be the stigma surrounding mental health. Despite progress, stigma continues to affect how mental health is perceived, discussed, and treated, especially within healthcare systems. We're honored to be joined by Dr. Jennie Byrne. Professionally, she's a psychiatrist here at Marvin. She has her own practice, which is ever expanding. Dr. Jennie is a best-selling author and leading voice in healthcare innovation. She also brings a unique blend of clinical, entrepreneurial, and leadership expertise, especially to us here at Marvin. And she is a strong advocate for supporting the mental health well-being healthcare of professionals. Dr. Jeannie and I hope to have a meaningful conversation today as we challenge assumptions, hopefully spark some dialogue, and explore how we can normalize mental health in healthcare settings. Hey there, Dr. Jeannie. Thank you for being here with us. And please share some more snippets about yourself personally so that everybody can get to know you a little better.
Thank you so much, Jacinta. Happy Friday, everybody. Jacinta and I were roughing it last time without power, but we both have power today, so it's pretty exciting. I'm very happy to be here speaking with you. Jacinta gave you a rundown on some of my professional background, but what I like to do is share a little bit more about me as a whole person. And as I'm talking about that, what I really am hoping is to spark in you some thoughts about how you show up to work and all the facets of you as a human being that show up today, because you're not just the professional person, there's many other parts of you too. So showing up as a full human being at work is profound to me. Some of the things that you probably wouldn't know about me from LinkedIn or other places is um, I'm a mom. I have two teenagers. I was just telling Jacinta. I have one going to college in the fall, which I'm pretty excited about. I have another kid uh, who is in they call it a punk adjacent band. They got a gig this weekend. So we were chatting about that. But I'm also a musician, and I used to not tell people that, which I thought was very strange. So now I actually share that. And I am also in a band. I play a couple different instruments. I used to be a classical musician when I started college, and actually did not want to be a doctor when I started college. That kind of came later. Some other fun facts about me. I live in North Carolina. I used to live in New York City for many, many years. I grew up in a very small town in central Pennsylvania. And I love fiber arts. And if you don't know what fiber arts are and you want to find out, please send me a message. I'll be happy to share. Maybe some of you are as well. So that's a little bit about me.
Thanks, great, so much. So I wanted to start today by acknowledging the emotional cost clinicians and healthcare employees carry, and to in some way try to highlight the importance of creating a space for reflection and connection. At the very core of it, this is why Marvin Behavioral Health came to be into existence. And if you could speak a little bit to what you are seeing as you treat healthcare employees here at Marvin, and also in your private practice and in the work that you do, it would be great to hear your insights on that.
So I've been drawn to taking care of other clinicians probably for about 15 years. I had a kind of traditional practice here in Chapel Hill. And over the years that I had that practice, I tended to attract a lot of other physicians and clinicians and other professionals. A lot of executives would come to me. And I didn't really advertise that, but I think the reason they came to me is that as a psychiatrist, normally people are coming to me at the worst. Most people don't come to a psychiatrist until they're really kind of hitting rock bottom, or a family member or a friend is telling them that they really need help, or sometimes professionally they've been told they need help and they're mandated to get help.
Mm.
And so people come to see me kind of on the worst day of their life, I would say. Most clinicians who see me, it's kind of the worst day of their life. And what I found was that they would come to me for medication, typically, maybe for psychotherapy. But what I would find very rapidly was that there was something special about being a clinician that even um, traditional psychotherapy, so psychotherapists who didn't work with a lot of clinicians, really struggled with. And that was kind of the day to day of what it meant to be working as a clinician. It had to do with the training and the kind of indoctrination that we get as part of our training. It had to do with the type of person or people that tend to go into healthcare, into medicine. And so there's this deep empathy for what it's like to be a clinician that I think a lot of people struggle with who haven't walked that path. So, what I really like at Marvin and in my private practice is when I work with another physician or nurse, I'm not a nurse, but I've worked with a lot of nurses and I've treated a lot of nurses. And um, I feel like I have a deep empathetic understanding of what life might be for them, even if I didn't work in their subspecialty. And so I can really draw on that to take apart what they're experiencing. And
Mm.
sometimes it's just validating. It's not like there's actually nothing pathologically wrong with them, but they have come to me feeling there's something wrong with them. And so after we kind of stabilize with a little medication or talk therapy or whatever, very quickly we realize they're in a system and an ecosystem that is not their doing, that is driving a lot of what they experience.
Okay. So if you were to think about stigma, something that can be deeply embedded in healthcare environments, how do you address the fear that clinicians, healthcare employees may feel about being judged for seeking therapy themselves?
The first thing I would say is that the fear is very valid, and historically, we have been penalized for seeking help.
Hmm.
So historically, every time, for example, I have to do a medical board renewal, or every time I have to do an exam or anything, it asks about your mental health. And it used to ask if you've ever had a history of mental health issues. Now there's legal things are changing where you're not going to be asking about that. But in fact, it was highly stigmatizing for everything, for licensing, for credentialing, for getting a job, for respect of your peers. We didn't talk about it at all. And if you had any mental health issue or substance issue, it was very validated. I mean, you really could lose your job and you could lose your license. And if you lose your license, you lose your career. And you have worked, I won't cuss on this call. You've worked darn hard to get that degree, to get that job. And the idea that it could all be lost is terrifying. And that's totally valid. So I think the first step is to validate the fear. Having said that, I do think things are changing, attitudes are changing. But I think the stigma is still there in the world at large, in the ecosystem when it comes to clinicians. It is decreasing, I think, but it is still there.
Do you think that there's a way that healthcare leaders could model vulnerability in a way that would reduce the stigma among the staff at different healthcare systems?
150%. So yes, yes, yes. What I have seen in my work, and I've done field work, I still see patients. I've been in a national executive, I've been at the state. I mean, I've kind of seen all the levels of the system and what leadership can look like, good and bad leadership. And the leaders that I find the most effective and the ones that create safe spaces to reduce stigma are the ones that are vulnerable and authentic. And, as I opened with, I showed up today as all these different things. I didn't just show up as a doctor today. I showed up as all of these parts of myself, and everybody does as well. And I think the authenticity comes when you can find pieces of yourself as a human that you feel comfortable sharing with other people, that feels okay to you. Like letting some of what makes you you outside of work come through in an authentic way that helps. and then sharing the stories that you have from your life. And typically by the time you're a leader, you've had, your mid-career perhaps, or you've had experiences, or others have had experiences, and they're not all good. And you've made mistakes. I've made many mistakes. Um, I've learned from my mistakes. And sometimes just telling those stories is deeply healing. And that's part of what I talked about in the book about moral injury. Is part of the healing of moral injury comes simply from having conversations about what our experiences are with peers that we can trust. So if a leader can foster a safe space for those conversations, that is profound, and it is the first step to healing some of the really awful feelings that clinicians are carrying, many clinicians are carrying around with them every day.
Yeah, that's a really great point. I think that if they model that behavior and they talk about it themselves with people to show that they're human, to show that it's okay to ask for help, then it really does. That's the best thing they can do, is to humanize that all of us need help at some point or other. Clinicians, I think, are often told to, take care of themselves. What do you feel like that looks like day to day?
Yeah, I'm laughing because we were chatting a little bit about this before we started the call today. Clinicians, we're just really bad at taking care of ourselves. Like, I'll just say it. Of course, there's some exceptions. Some of you out there may be really good at it. I was terrible at it. I wasn't even as bad as my colleagues in school, for example. I remember they'd be sleeping like 2, 3 hours a night, running to the anatomy lab to study like in the middle of the night. And I slept, I think, 6 hours a night. And I felt like I was like really taking care of myself. But I've come to realize over the years, like I have a lot of habits and patterns from my training years, which were very not helpful. And as you get older, especially like I'm a little older, they kind of catch up with you. And so I've had to really work on setting new habits and patterns. So I think when people tell the clinicians to take care of themselves, I don't know, that always rubs me the wrong way, Jacinta. Like I feel like it's very patronizing, and it's kind of, it lacks empathy for what it's like to be a clinician. Like, oh, go do yoga. Oh, meditate. Everything will be great. I feel like that's such a vast oversimplification. Like, yes, yoga can help. I'm a big fan of yoga. Yes, meditation can help. I'm a big fan of that too. But like just saying, oh, go eat some more vegetables and do some yoga, like that's almost, I don't know, that rubs me the wrong way. I think you really need to start by validating the experience and the fact that many clinicians have been trained to not take care of themselves for years, if not decades. And so undoing all of that and finding a way to do it within your workplace, because everyone around you is also not taking care of themselves. So the cultural norm is not to take care of yourself.
Yeah.
So every time you try to take care of yourself, you're fighting against the whole cultural norm of where you go to work. And we know this like logically when we work with our own patients, right? If my patient comes to me and says, "Oh, I'm sleeping 4 hours a night, um, I'm doing better than my friends. I'm sleeping 6 hours a night." I'll be like, "Well, you know, is that enough sleep? 6 hours enough? I don't know. You tell me." So if we flip it and think about ourselves as a patient, right? Like if we think about it that way, I think sometimes it's a lot clearer where we're not taking care of ourselves. And then again, not necessarily internalizing the blame and saying, "Oh, this is my fault. I have to deal with this," but to say, maybe part of this is me, maybe part of this is the environment, maybe part of this is the friends I'm around or the culture I'm around. And yeah, it's going to be hard because the culture is not going to change overnight, of where I go to work every day.
Yeah, that you reminded me of something as you were talking, is that the way we talk to ourselves, the way we treat ourselves, if we would treat ourselves as we would somebody that we love 100% completely and totally, if we would talk to ourselves as kindly as we talk to those, that we love, we would be a lot more forgiving, we would be a lot more kinder to ourselves, and we would treat ourselves better. I I try all the time to not be hard on myself, but it takes daily practice, I feel.
And, being hard on yourself and being, a hard worker, working late, like those behaviors may have been very adaptive in your school years, especially, right? Like not needing to sleep, not taking a lot of time to cook meals, not hanging out and drinking with your friend. Like all of those behaviors probably served you well when you were in training. The problem is at some point they become maladaptive, and then it's hard to change after it's been so many years and so many people around you. Um, but you're right, like the, we're not very kind to ourselves typically. We're really not.
Why do you think that is?
I mean, I can speak for myself. I feel as a physician, I have felt like I have to be perfect, that that was drilled into me pretty heavily that I had to be perfect and that I would be a bad doctor, a bad clinician if I made any mistakes, literally like a single mistake. Um, and that somehow my body, I think the other interesting thing is I'm getting older is that I'm much more aware of my body than I ever was when I was young. And, when I was young, it was just something that carried my brain around, right? Like I was very focused on like my brain. And now I'm like, oh no, your body, you better pay attention. And so I was taught anyway to kind of detach a little my brain from my body. Like for example, if I was in a surgery rotation, I would be the one retracting the tissue for one time it was 8 hours. And if you moved like an inch, the surgeon would yell at you. And it was, yeah. So, you're taught to put your body aside and to just focus on the cognitive task in front of you. And so from, and I personally grew up that way as well. I don't know, a lot of people's families, I was taught growing up that like your body is not something important and it's just your brain. And so I had that growing up, and then I had it really deeply reinforced in all my training and my work years. And so it's only now that I still struggle to kind of, it sounds funny, right, Jacinta? But like, I don't
Well,
even, I didn't even know when I was hungry. I know this is going to sound absurd to anybody listening out there, but like, I had so conditioned myself not to listen to body hunger cues because of my work years that I actually about 2 years ago had to like learn with a nutritionist, like how I knew I was hungry. And this sounds ridiculous, but I don't think I'm alone. I really don't. I think a lot of us are very detached from our bodies, and we were trained that way.
we have a question in the Q&A. The question is, respond?
Mm.
How do we respond when leaders indicate that they are too busy to take care of themselves? The, there really is, there really is that they have multiple competing priorities and they are treading on water, especially in healthcare.
Thank you, Sharon, for that question. I love this question so much. And the key word I love in this question is busy. And I have a lot of thoughts about this. I won't bore you with all the details, but I wrote a book, first book called Work Smart. And I did a lot of research into the new ways that we work together. And what I learned is this idea of busyness is a cultural construct that is less than 100 years old that our culture has created. And so we are always busy. And if you think about it, the last time you asked somebody, oh, how are you doing? I'd say 75% they probably said, I'm busy or I'm crazy busy or something like that. We don't even realize that this busyness concept is a new concept. If you were in 1850 and you were wealthy to do, the goal in life was to have leisure. The goal was not to be busy. But now we wear busyness as kind of a badge of honor, even though we hate it. We simultaneously hate it, but then we brag about it. So my answer to the question is like, how do I respond? I very gently and kindly push on this idea of being busy. And I kind of look at the history of busyness and talk about where this came from. And then I sometimes will be gently challenging. So, for example, we don't have control over many things in life. This is true, especially in healthcare. We don't have control, but we have a lot more power than we think we do. And the most profound change in the last, I guess, 15 years now is this thing, right? This thing, this phone that we carry around, this tool that we have developed, is creating a false sense of busyness, and it is sucking up huge amounts of our time and our mental energy. And there is a huge amount of money and time and effort going into creating products that will take your time and energy from you because that is exactly what the scientists have designed them to do. So when I work with leaders and I coach a lot of executives and healthcare leaders, the first thing we do is actually we look at the use of their device and we talk about it just very honestly. Well, like, let's look at it, open it up. Let's look at the time you spend on the device. What are you doing? What are the notifications? Like, very practically, like, is that how you want to use your robot? Is that the best way for you to use it? So we start to carve little chunks of time. And I find that, like, when you start to carve the 5 minutes in the day, and I call it like sit and look at the wall time. You don't schedule anything during that time. No meditation, no yoga, none of the self-care activities. Literally, I want you to just sit and stare at the wall or the nature, ideally nature, if you're in nature, for 5 minutes. Once we start to carve out 5 minutes, it really can have a snowball effect in terms of then you can really have a clear mind to think about all these things you say yes to. The key is that we say yes to too many things. And Sharon, that's what you're saying in your question, right? Competing priorities. If you say yes to everything, you don't succeed at anything. So the art of saying yes and the art of saying no is where most of us, myself included, fall down. So I have become self-aware enough to create an entire system, including an assistant that helps me to know how to navigate saying yes and saying no. And I'm not perfect at it, but I am much, much better than I was 5, 10 years ago. And people look at my, online presence and they say, "Oh, you're so busy, you're so busy." And I say, "Actually, I'm not busy. My life is full, but the things in my life I choose to do. And I have to say no to so many things to say yes to these things." So my short answer would be I gently push on the busy concept and as a cultural construct rather than an individual failing. And then really just pragmatically go bit by bit to try to dismantle that and to challenge them. And it's hard again because the society around you is the busy culture. So even if you are detaching from that, it is hard because everyone around you is probably still doing that.
We have a question as well from Patrick about the organizational culture and how everything is rush, rush, rush. And let me just see here.
Yeah.
Uh, he's talking about leadership turns a blind eye even when there's burnout, and you know, sometimes there's consequences for that. And trying to find the need for work-life balance can be different, and prioritizing your mental health. It's baffling that as healers we can't see the issues and the damage we impose on ourselves. This is such a true point, Patrick.
Yep. And I think that, I could answer in a lot of different ways, Patrick, but I would say, first of all, there's a little bit of an assumption in the comment that his leadership is turning a blind eye to burnout. And I would say in all of the executive rooms that I have sat, they're actually very worried about burnout. They just don't know what to do and they don't know what to say. So they act like it's not a problem. But if you sit in the room, normally they are actually very concerned. If they're chastising you, mm, that's not creating a safe space to talk about it, right? So that's highly problematic. A good leader, a good leadership structure will create the safe space to at least have the conversation, even if there's nothing that they can do. I think the best leaders are the ones that help you say no to things. I felt like many of my jobs, that's all I do is I say no, 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 no. Like, stop doing that. You don't need to do that anymore. Like, here are all the things I want you to stop doing instead of here are all the things I want you to start doing. But in terms of like why we can't see it, I think that nobody knows what to do. So they just keep doing the same old thing, which is the Ford factory floor. That's what we know how to do. That's what we think works. Clearly, it's outdated. Clearly, it doesn't work. But people don't feel like they have a solution. So they are often, the leaders are putting on this persona of like, I have all the answers. But when you talk to them and you interview them anonymously, which I've done for the book, they are actually sometimes the most distressed and the most morally injured. And they're the ones who go home and drink all night and have terrible relationships. So, like, I wouldn't assume just if they look like they know what they're doing on the surface, they have it all together. I wouldn't assume that they do, because behind closed doors, I see a pretty bad picture of what it's like to be a manager and a leader today. So there are, of course, exceptions of some leaders who really just don't give a crap. But I think overall, the ones I've known, they're actually suffering and they just don't know what to do. So they pretend. And then nobody feels good. It doesn't go anywhere.
So if we were to, as we wrap up, if we were to talk about the role of therapy and how that plays into our well-being, not just as providers, as people, as showing up, what is the best piece of advice you could give to folks about going to therapy, about engaging in therapy, and just self-care overall?
Full disclosure, so I did psychotherapy for 4 years in New York City on the couch. I actually went twice a week. It was with somebody who was trained as an analyst. It wasn't technically psychoanalysis. And it was profound. I only did it because somebody told me I had to do it. I never would have gone. I was a complete skeptic. I was like biology, biology, biology. But my residency director said, I want all the residents to go. And so
Nice.
I was, yep, I do what I was told. So I did it, and it was profound. Um, but I haven't needed to be in therapy my whole life. And actually, there's been times when coaching has been very powerful for me. And then there's, I think, long-term peer supervision or peer coaching or peer support of some kind with other psychiatrists or clinicians long term. That's the thing I want in my life all the time. Therapy I have found really helpful for certain events in my life or certain issues that I just kind of can't figure out on my own. So for me, that's the kind of therapy that's been helpful. And then long term, though, is where I really want that peer support and friendship and collegiality. That's what I need every day.
Different phases of life, different stressors, different scenarios that present itself. Well, I want to thank you for being here today. I want to encourage those who attended to reflect on some of the takeaways that we got from Dr. Jennie today, and I hope that you can apply them to your lives. We'll be putting some of this up on social media if you want to see it again. But thank you, Dr. Jennie, and I hope everybody on this call has a wonderful weekend and take some time for yourselves.
Thank you. Bye bye, everybody.